Okay, we're looking in the nasal cavity into the nasopharynx, oral cavity into oral pharynx. And again, here we've got the olfactory nerves coming through the cribriform plate. This is the external nasal branch of the anterior ethmoidal. This is the pterygopalatine ganglia with the palatine nerves coming out below it. Palatine nerves are going to be coming through the greater and lesser palatine foramen back here. These are lateral nasal branches of the nasopalatine nerve, supplying the skin on the inside of the nose. We come back here, this is the torus tuberous on top of the opening to the eustachian tube, tensor villi palatini, levator villi palatini, salpingopharyngeus, and your pharyngeal tonsils. These are your pharyngeal constrictor muscles back here, superior pharyngeal constrictor, middle pharyngeal constrictor, inferior pharyngeal constrictor, which lie directly on top of the retropharyngeal space. We come down here, this little one here coming through the incisive canal is the incisive branch of the nasopalatine nerve. We've got greater and lesser palatine nerves in here. We come down here. This is the submandibular gland and this one's the submandibular gland. This is the sublingual gland. This is the submandibular duct, which is responsible for gleeking. These glands are innervated by the facial nerve via the lingual nerve, and this is the submandibular ganglia down here. We come down way down there, we look at number 37, that's the hypoglossal nerve coming up to innervate the rest of these muscles. Number 16 is the genioglossus, 15 is the mylohyoid. We come back here, this muscle here forming the palatoglossal arch will be the palatoglossus. Back here is the palatopharyngeus, and number 14 is the palatine tonsils. Look down, I'll let you review, don't forget to review the larynx before going into boards. Remember, quadrangular space, vestibular fold containing the vestibular ligament, ventricle, vocal fold containing the vocal ligament. Just your parts. Remember, most motor control of the larynx, all motor control of the larynx is via vagus nerve, both sensory and motor. This is the one that gets us into our infratemporal fossa here. We've got all of our branches of trigeminal. So here's our trigeminal nerve, here's our trigeminal ganglia, this is ophthalmic branch of trigeminal. It's giving you a lacrimal branch and a frontal branch. Frontal branch would be branching into supraorbital and supratrochlear. Maxillary branch of the trigeminal is going through foramen rotundum, giving you that little pink dot down there is the pterygopalatine ganglia. Coming south out of the pterygopalatine ganglia will be our palatine nerves. This branch of maxillary here, going through the inferior orbital fissure, is going to give off zygomaticotemporal and zygomaticofacial. You can't tell which these ones are. And then it ends here as the infraorbital. Other nerves we have coming through the orbit here are going to be cranial nerve trochlear, oculomotor, and abducens. 29 is trochlear, 31 is oculomotor, 44 is abducens. They go through the cavernous sinus and then the superior orbital fissure. Number 30 right there is the ciliary ganglia. This is going to be the inferior branch of the oculomotor and the superior branch of the oculomotor, and then we'll also have nasociliary, short ciliary, long ciliary. That's going to be more visible in the actual orbit model itself. But this one out here that has been tagged before is the external nasal branch of the anterior ethmoidal nerve, which is going to provide sensory to the face here. Other branches of maxillary, after giving off these ones, we've got the posterior superior alveolar, which you can see are supplying the upper teeth here. Mandibular branch of trigeminal comes through foramen ovale, which is right next door to foramen spinosum. Foramen spinosum is transmitting the middle meningeal artery. Coming through foramen ovale, we've got mandibular branch of trigeminal. These two little strings up here are the deep temporal nerves. We're going to have this nerve right here that's crossing the middle meningeal artery and then heading north with the superficial temporal nerve. This is the auriculotemporal nerve. Coming down here is the inferior alveolar nerve. Before it enters the mandibular foramen, inferior alveolar nerve is going to give off nerve to mylohyoid. Inferior alveolar nerve is then going to supply all of the lower teeth and also give off the mental nerve, which comes through the mental foramen to supply the skin on the chin. Here is our lingual nerve here. Lingual nerve is joined by this little itty bitty string right here. This string, you can be careful with these ones. This string is coming off facial nerve, and that's the chordae tympani nerve. Chordae tympani nerve joins lingual nerve. And then we've got the buccal branch of the trigeminal here, which is going to innervate the skin on the inside of the cheek. Coming back here, we've got facial and vestibular cochlear going through the internal auditory meatus. Facial nerve is making a turn here to exit via the stylomastoid foramen. Before it does that, though, facial nerve is giving off this chordae tympani nerve. Facial nerve then comes down here, and the outside is going to branch into temporal zygomatic buccal. This is the mandibular branch of facial nerve, and this is the cervical branch of facial nerve. We look way in there, and that's cranial nerves 9, 10, and 11 coming through the jugular foramen. Way back here, this is cranial nerve 11 going to SCM and trapezius. Way deep in there is cranial nerve 9. 9's landmark as he goes medial to the styloglossus muscle. And then we've got 10 coming down here. Vagus gives off the superior laryngeal nerve, which branches into the internal laryngeal and the external laryngeal nerves. So vagus can be tagged here with the superior laryngeal branching into internal and external. Number 48 we see here, crossing the carotid artery. 48 is the hypoglossal nerve. Hypoglossal nerve is giving off nerve to thyrohyoid. Superior pharyngeal constrictor, middle pharyngeal constrictor, inferior pharyngeal constrictor. This is posterior digastric and stylohyoid, which are innervated by the facial nerve as it exits the stylomastoid foramen. Down here is anterior digastric and mylohyoid, which are innervated by mandibular branch of trigeminal. Here's the submandibular ganglia, which is innervated by the facial nerve. Remember, the parotid gland is innervated by the glossopharyngeal nerve, even though facial nerve comes through it. Okay?